Hello everyone, my name is Vaishali and I'm here to teach you your OSCE procedures. Well, if you want to know something related to nursing, please don't hesitate to subscribe my channel. You can subscribe my channel and you can ask any questions in the comment box. I will definitely gonna help you with that. So let's start the video with the first procedure, and the name of the procedure is fall risk assessment. So this is the first procedure. So alright, the first step is to understand the scenario because it might be your station. So the name of the station is fall risk assessment, but they will not mention this in outside your station. So you have to self-analyze it whether this is a fall risk assessment or not. So let's read the scenario first. Mrs. Polly is 93 years old, resident at your nursing home. She has had Alzheimer's for years and recently lost her husband. She also has diabetes, hypertension, osteoarthritis, and depression. She takes several medications for her conditions. Recently, she has worsening agitation and insomnia. She was in the hospital for dehydration and treated for a UTI. Recently, she was found on the floor beside her bed and her undergarments were wet. She was calling out for her husband to help her. So this is the scenario. Now you have to analyze by the scenario that this patient is high risk on fall. So you have to fill this form. This form will be in the station, okay? You have to fill this form. Simultaneously, you have to talk to the patient. You already know all the history of the patient. Now you're talking to the patient and trying to get the answers from the patient so that you can fill this form. If you fill this form, you find it out whether the patient is on high risk or medium risk or low risk. That's good to go now. You pass the station. So let's start how you enter the station and how you perform the station. Okay. So the door is closed. So I'm closing the door to maintain the privacy. I can see that the scene is safe to proceed. I'm doing my hand hygiene. Hello, my name is Vaishali. I'm just a nurse looking after you. How are you? I'm not fine. Okay. So the reason why I'm here is that I'm going to ask you a few questions. I might examine you. Is that okay to you? Yeah, it's okay to me. All right. So before doing anything, can you please tell me, are you comfortable at the moment? Yeah, I'm comfortable. Okay. So can you please confirm your ID to me? All right. So this is the form. This is the file of the patient. All right. This is the patient's hand. Okay. So can you please confirm your name for me? Name Mrs. Polly. Mrs. Polly. Okay. Thank you so much. And your date of birth? Can you please confirm that for me? 220849, 220849. All right. I can see that your MR number is 46242, 46242. So basically on the hand, there will be an ID band. And in the file, there will be one sticker or the data of the patient. So the first step is you have to cross-check the ID of the patient. I hope I make it clear. So you close the door, you check the safety, you ask the patient, you introduce yourself, you ask the patient, are you comfortable or not? And at the last, you ask the ID check. Now the second part is allergies. So Mrs. Polly, do you have any allergies? No, I don't have any allergy. All right, let me cross-check in your file. Yeah, I can see that it's not mentioned here. You are not allergic to anything. That's great. Thank you so much, Mrs. Polly. Well, Mrs. Polly, as I mentioned earlier that I'm going to ask you a few questions. Is that okay to you, right? Yeah, it's okay. Full stop. Now the second part. So now the second part is the main part. That is your form questions. You're not going to ask a lot of questions because you have only 8 minutes. You don't have any full day. All right. So you have only 8 minutes. In 8 minutes, you have to fill the form also and you have to ask the questions also. So always ask the patient, did you have a history of fall? If she say yes, it means she is on high risk. Number 2, if she says no, then the next question is, so when did you had your last fall? Then she will say yesterday, because according to scenario, patient recently she was found on the floor bedside her bed, okay, and her undergarments were wet, so she had fall yesterday. But maybe she's dementia patient or she's Alzheimer's, she don't know, but you know that. You have already read in the scenario that yesterday she had fall. right? That's why she's in hospital. So your first question is the history of the falls. Recent history, the old history, whatever the data related to the history of the fall, you're gonna fill that form. So there will be one box, one question, that is a history of the recent fall. Okay, if she had fall yesterday, she is on high risk. If she had fall 6 months ago, that is also she is on high risk. So the first question is, when did you had your last fall? Okay, now the simultaneously the second question after the first question will be, what happened actually at the time? Were you feeling dizzy at that time? That was the reason of your fall? Or what you experienced at that time? She might say something or she might not say something. It depends on the actor. It depends on the patient who is the actor. So it depends on that person. But don't worry, if he's not answering, fine. You are there to assess. You are not there to take your answers. You are there to assess the patient. That's all. If he's not answering your question, that's good. It means the patient is on high risk. He's confused. He don't know what to answer and what not to answer. You understand my concern? So the first is history of the fall. Patient's history. When did he or she had last fall? And what happened at that time? Is she remember or not? So that is the first question. The second question, can you please tell me, do you have any underlying medical conditions? Mrs. Polly, can you please tell me, do you have any underlying medical condition? For example, like issues with heart, liver, your nervous system, anything you are visiting doctor for that reasons? No, I don't remember. Okay. Now, let's read the scenario because you already know the scenario. In the scenario, she's an Alzheimer patient. So she has some issues with her neurological system, right? And then after, she has hypertension, she has diabetes, she has osteoarthritis, she has depression. She has a lot of medical disease conditions. See, if the patient is not answering, don't worry. Maybe the patient is confused. Maybe the patient forgot. Maybe the patient don't know the medical terms. But you already know from the scenario that yes, the patient is suffering from some medical underlying conditions. All right. So the first question was the recent history of the falls. Now the second question was medical underlying disease conditions. And the third question will be, so, Mrs. Polly, okay, you don't know, right, your medical condition, but don't worry. I will ask the doctor to review your medical conditions, okay? And then I will chart in your chart. Is that okay to you? All right. So, Mrs. Polly, are you taking any kind of medications, like for your blood pressure or for anything like you eat? Yeah, I'm having 4 or 5 medications, okay? And do you know the rationals? No, I don't know, but I eat like 5-6 medicines. Oh, okay. So after eating the medication, do you feel dizzy or sleepy? No, I don't feel. Okay, full stop. Whatever the answer you are getting from the patient, okay, no worries, okay? The third question you asked about the medication, so you're gonna tell the patient, I'm gonna share these findings to the physician and will ask the physician to review your medications also. Is that okay to you? All right. That's all. The third question, the 3 questions done. So according to the 3 questions, you already know that the patient is on high risk. Patient is on recent fall. Patient had medical conditions. Patient is on medications. So the patient is on high risk. Now the fourth question. The fourth question will be glasses. Are you wearing any kind of glasses? She will say, no, yes, I don't know. Whatever she says, it depends on her. If she says yes, where is it? Can you please show me? If they are on the eye like she is wearing, then that's fine. So then you will ask, so when did you had your last visit to the ophthalmologist? She will say, no, I don't remember. Okay, so you know what, sometime glasses also, we don't know your current vision, so we need to refer you to the ophthalmologist so that he can update your vision, and according to your vision they will provide you glasses, because we don't know what's the reason for your fall, right? Okay, full stop. So glasses portion done. Now the next portion we have is the mobility. Okay, the next question after the vision, after the glasses, the next question is mobility. So Mrs. Polly, do you know where is the washroom? Yeah, it's there. Yeah, that's fine. And where is the main door? It's the no, Mrs. Polly. The main door is to the left side. Okay, but don't worry. Whenever you want to get off from the bed to go to washroom or somewhere, please let me know. Just press the buzzer. I will be there for you to help you. Is that okay, Mrs. Polly? All right. So don't worry. Okay, don't get off from your bed by yourself. Just press the buzzer. I will be there. Okay. All right, Mrs. Polly. Can you please tell me? Like yesterday you had fall, right? So are you using any kind of crutch? Are you using any kind of mobility aid? Yeah, I'm using. Oh, can you please show me where is it? She will say maybe under the bed, maybe somewhere. So you have to go and wash that. It's important because you should aware of what kind of mobility aid she is using. So this is something important. You have to look the mobility aid. So maybe she say under the bed. So you have to look. Okay, I can see that. I can review. Okay, fine. Thank you so much, Mrs. Polly, for letting me know that. Well, I will refer you to the physiotherapist. Okay, they're gonna assess your mobility aid and they will also assess your gait, so that if there is any need for updating your mobility aid, they will do that for you, just to prevent you from another fall. Is that okay to you, Mrs. Polly? Yeah, that's fine to me. Okay. Now, so first was the recent history, the second was the medical underlying disease condition, the next was your medications, the next was your vision, the next was your mobility and transfers. Now the next thing, environment. We have also included the environment. Now Mrs. Polly, so are you able to go to washroom, or are you taking any kind of help from your family members? Whatever the answer she will say, okay, accept that. Okay, Mrs. Polly, are you using any kind of sanitary pad or incontinence pad? Yeah. Oh, okay, let me do my hand hygiene. Is it okay if I can look for that? Yeah, you can look. Okay, so I will look for the sanitary pad, the incontinence pad. That is also important. Maybe she don't know. She feel like she has something, but in reality she is not wearing any kind of a incontinence pad. So maybe she's confused. So you have to make sure that whatever she's saying, is that correct or not. Otherwise you will provide her incontinence pad. Okay, I hope I made it clear. Then after, you can also ask like, do you have full bladder control or bowel control? She will say, yeah, I have full control. That's good. But if she's not having full control, then it's a red flag for us. We have to maintain her, like we have to change the incontinence pads after second hourly, third hourly, so that she don't get irritation in her perineal area, because that might be the reason she will get off from the bed. She's feeling some irritated, she's not comfortable, and obviously she want to go to washroom, right? So we have to prevent this thing. Now the last, we will ask the nutrition. The last question is related to nutrition. We're gonna ask the patient, can you please tell me are you able to eat enough food at the moment, or you're not your appetite is not good? She will say, yeah, not good. Okay, so if I like rate you, I'll give you food in the whole plate, are you able to complete that plate or half of it? She will say half of it, less than half, or maybe more than half. That's her answer. Okay, so you're gonna say at that time, well, Mrs. Polly, I'm going to refer you to the nutritionist, so that she can make a good nutritious dietary plan for you, and you're gonna feel much better after that. Is that okay to you? Yeah, it's okay to me. Full stop. So these are the question parts. This is the form that you will treat. So I will send this picture at the end. I will attach the the picture of the form, okay, at the end of this session. And that's all, guys. It's all done. You are done with the questions. Now, Mrs. Polly, according to my questions, is that okay if I can chart? I can document. Is that okay to you? All right. Thank you so much, Mrs. Polly. Now it's the time to document everything. You will document. All right, Mrs. Polly, according to my assessment, you are on high risk. Okay, so I'm going to shift your bed just next to my nursing station, so that we can strictly observe you. And I'm also going to put one sensor pad under your bed sheet and under your foot mat and under your chair, so that whenever you move, and we will get a bell, and we will come to help you. Is that okay to you? And I can see that you are wearing some kind of footwears, but Mrs. Polly, I need to change these footwears. I will provide you some anti-slippery footwears. Is that okay to you? Just to prevent you from any kind of fall. And other than that, I will also ask my colleagues, ask for help to move you, to provide you comfortable position. Okay, so please don't get from the bed all alone, just press the buzzer, and so that I will be there to help you. Okay, and I will also gonna put all your valuables just next to you, so that there is no need to get off from the bed. Okay, is that okay to you, Mrs. Polly? If 8 minutes and good to go, you have done your everything. The last thing, guys, how you close the station. So you will say, thank you so much, Mrs. Polly, for your answers and your cooperation. Okay, I'm not going to leave you, I'm just next to you doing my documentation. If you want to know something, or if you have any concerns, you can ask me. Is that okay to you? All right, that's all, guys. That's the way how you close the conversation. And this is a form. I already explained everything, I already teach you the management. This is a station, and it's not that difficult, but this is a very common station. Yeah, like most of the students get this station. So I hope I made it clear and this video is helpful to you. Bye guys, wait for my next video and stay tuned with me. Please don't forget to subscribe my channel.